Hello, this is the digestive system part 2. So this is where we left off. So we just passed through the esophageal sphincter, that muscle there that prevents acid from flowing back up into the esophagus but allows food and fluids to move through. And now we've entered the stomach. Our stomach acts as sort of a temporary storage tank so that we can put food in there and then go about and do other things while it's being digested. The stomach plays a role in digestion. It helps prepare food for further digestion further along the digestive tract into the small intestine. It holds about 5 liters, and food will stay in our stomach for about 2 to 3 hours before it moves on. Here's a look, an endoscopic look inside the stomach. So this top left picture, this is the upper stomach. It's also called the fundus. This is the lower stomach, also called the antrum. And if we go right to the very end of the lower stomach, if we pass through this little hole, we end up in the small intestine. And this little hole is also a special muscle called the pyloric sphincter. And again, it stays closed to keep food in the stomach until it's ready to move on, and then the stomach will contract and push that food through the pyloric sphincter and then into the small intestine. So there are 2 different types of digestion that occur in the stomach. So number 1, mechanical digestion. So the stomach is surrounded by 3 different layers of smooth muscle, and they're all oriented in different directions. So there's some muscle that's oriented in a longitudinal direction, some in an oblique direction, and some that circle the stomach this way. And so when all of those muscles contract, it causes the stomach to be able to churn and really move and pummel and mix the food into smaller and smaller fragments. And this makes it easier to digest further along. The second type of digestion that occurs in the stomach is chemical digestion. So the stomach is covered with, the stomach lining is covered with these little pits or glands. They're called gastric glands or gastric pits. And so this is the lining of the stomach, and here we see this pit. And the pit is lined with different types of cells that produce different substances. So for example, there are cells close to the surface that produce mucus, and of course the mucus is what protects the stomach from the acid that's in the stomach and the enzymes, so it protects it essentially from digesting itself. There are also cells that produce hydrochloric acid. These are called parietal cells, and we're going to talk again about these in pharmacology, because if we can come up with medications to help reduce the amount of hydrochloric acid these cells produce, then that's going to help reduce the acid content of the stomach if you needed to do that. Hydrochloric acid is important for digestion. It doesn't necessarily affect the food molecules itself, but it helps create an enzyme. So the enzymes that are produced by a type of cell called chief cells, and they produce a big, large molecule called pepsinogen. And pepsinogen is not active, but when hydrochloric acid breaks down pepsinogen, it turns into pepsin, and pepsin is an enzyme that breaks down proteins. So these 2 cells work together in order to ultimately produce this pepsin, and that starts to chemically break down those proteins. There are also cells in the gastric pits that produce different types of hormones. Hormones like gastrin and secretin, and I won't be asking you about those particular hormones, but they're released into the blood and they help regulate digestion. So here's a look into the stomach lining. So we can see the stomach is full of folds. We can also see glistening, that mucus that protects the lining. And if we zoom in and take a higher magnification picture, we can see these are the pits. These little holes here, these are these big pits. And if we went down into that, we would see different types of cells that are producing different substances that are required for digestion. Once food leaves the stomach, it enters the small intestine. The small intestine does the majority of digesting, the chemical digestion of food into small molecules that are small enough to be absorbed into the bloodstream. And all of the food molecules that are going to be absorbed into the bloodstream are absorbed in the small intestine. So our small intestine is about 23 feet long, which always amazes me a little bit that it all fits into that very small space. It's about 1.5 to 2 inches in diameter. This upper picture is an endoscopic view of our duodenum, which is the first part of the small intestine. Then the duodenum empties into the jejunum, which is the next part, and then the ileum, which is the last part of the small intestine. This lower picture is an endoscopic view of our jejunum. I want to mention an accessory organ at this point because this organ works together with the small intestine to help chemically break down foods. So this is the pancreas, and the pancreas is a gland that is located right underneath the stomach. And there are a whole bunch of different types of cells in the pancreas. Some of these cells produce hormones like insulin, and we're going to talk about that when we talk about the endocrine system. But there are some cells called acinar cells, and these cells produce digestive enzymes. Things like proteases, lipases, amylases, to break down carbohydrates and fats and proteins into molecules small enough to be absorbed into the bloodstream. So the cells in the pancreas produce these digestive enzymes, and then they secrete them down this little duct, and they empty those enzymes into the duodenum so they can start to work breaking down the food molecules the food that comes from the stomach. The other thing that's produced in the pancreas is sodium bicarbonate, which is exactly what baking soda is. And this neutralizes the stomach acid. Again, just like the esophagus, the duodenum doesn't have that really thick mucus layer. And so it's necessary to make the substances coming out of the stomach less acidic so we don't end up damaging our duodenum. Also, there, just around here, this area, are two other accessory organs. This big organ here is our liver, and the little green thing underneath that is our gallbladder. And there's a little duct that empties also into this duodenum. The liver produces a substance called bile, and that bile then moves down into the gallbladder, which then stores it and concentrates it. So it takes the fluid out of it and makes a very concentrated substance. And then that concentrated bile is then secreted. It goes down the bile duct and right into the duodenum. So here we've got the stomach. There's the first part of our small intestine, the duodenum. And here's our pancreas producing digestive enzymes and sodium bicarbonate and dumping it in. And here's our liver and gallbladder producing bile and dumping it into the duodenum. Now what bile does is it mechanically breaks down large fat molecules into smaller ones. So this is not an example of chemical digestion. This isn't an enzyme. It's literally taking big clumps of fat and kind of like adding detergent to an oily pan. It's going to break that fat or break that oil up into little smaller pieces. And when we break it into little smaller pieces, then that allows enzymes coming from the pancreas to work better. Just a note here about our liver. We're talking about some functions of the liver with respect to our digestive tract, but the liver is actually truly amazing. There are over 500 different functions that the liver does, and we're just talking about one very small part. The liver is the largest gland in our body. It has 2 main lobes. It is crucial for life, so it performs many vital functions, from our immune system to our blood to storage of nutrients to metabolism and of course the role in digestion. The other amazing thing about our liver is it has a unique ability to regenerate. In fact, you can remove between 25 up to 65% of your liver, and the rest will grow back in a few months. And so that makes it possible to be a living donor of a liver. Somebody needs a new liver, then you could donate a portion of your liver, and it would grow in that particular person, and you would regenerate your own liver. And so that's an amazing feature of our liver. Inside our small intestine, there are cells that line the small intestine that also secrete enzymes. So we get these digestive enzymes from the pancreas, but also from the cells that line the small intestine. And again, these are enzymes break down our macromolecules, so they break down proteins, so those are protease enzymes, carbohydrates, those are amylase enzymes, and fats, those are lipase enzymes. What I'd like you to take a look here. So this is the lining of the small intestine, and we can see that there are these finger-like projections. We call those villi, and we're going to talk about those in a second. And if we zoomed in on the surface of the villi, we'd actually see these even smaller projections, and those are called microvilli. Now, the fact that there's all these folds and projections in the lining increases surface area. And that's incredibly important because it means that we can absorb more food molecules faster. So here is a little cross-section of a villi, one of these little projections. And you can see that the blood supply runs right through this villi. And so as food is moving through the lumen of the small intestine, those food molecules can be absorbed into the blood. Directly into the blood, simple sugars and amino acids, the result of chemical digestion, can be absorbed there, and they're in the blood. And there is a little lacteal, and it's the part here, it's actually part of our lymphatic system, and it can absorb fatty acids and glycerol, which is the breakdown of fats. So how long does it actually take for complete digestion of a meal? Somewhere between 24 to 72 hours. A peptic ulcer is an open sore that develops on the inside lining of your digestive tract, most commonly either in the lining of the stomach, and we call that a gastric ulcer, or the upper part of the small intestine, the duodenum, and we call that a duodenal ulcer. There are things that can aggravate ulcers, but interestingly enough, there are really only 2 main causes. One is a type of bacteria. It's a bacterial infection. It's called Helicobacter pylori, or H. pylori, and it is a special bacteria that is resistant to acid. The other thing that can cause or be the underlying cause of an ulcer are overdosing, or especially over long periods of time, certain drugs, particularly NSAID drugs, things like ibuprofen and aspirin. So either the bacteria infection or these types of drugs start to irritate and break down the mucus lining of the stomach. And once the mucus is gone, then the acid and enzymes that are produced in the stomach can start to damage that underlying tissue. Symptoms of an ulcer are often stomach pain that occurs about 1 to 3 hours after a meal, but it goes away immediately after eating. And that's just has to do with the amount of acid that is in the stomach and the acidity that's in the stomach. Loss of appetite, increased burping, things like nausea and vomiting, and sometimes the vomit can contain blood, or we might see blood later on in the digestive tract in the stools. And when it comes through the stools, it's not going to be bright red, it'll be more of a coffee-colored substance that you'll see in the stools. Okay. Once the food leaves the small intestine, so by the end of the small intestine, all of the food molecules that are going to be absorbed are absorbed. And so what is left is water, which our body can use, so we want to reabsorb that, any food that is indigestible, and bacteria. So as substances then move through our large intestine, which is this big sort of colored red organ here, then we're going to absorb water. We're also going to absorb salt, so sodium and potassium will also be absorbed. We also have our own contingent of good bacteria, and that good bacteria that lives with us all the time is going to make us some things. Vitamin K, some of the B vitamins are going to be absorbed. And anything that is left over is what we call feces or stool, and that's going to be delivered to the rectum so that we can secrete it. Our large intestine is about 3 to 4 inches in diameter. That's why it's called the large intestine, but it is shorter than the small intestine. It's only about 5 feet long. So normal E. coli in our colon manufactures vitamin K, and we have about 400 different species that are unique to each of us. So each of us have our own set of 400 different species of bacteria. Take a quick note down here, this little thing down here in the lower right quadrant of our abdomen, this is our appendix, and it is part of our lymphatic system. It is open and can fecal material, stool material can go into the appendix, and if that happens it can become inflamed, and we call that appendicitis. If that stuff becomes trapped in there, the appendix may start to swell and may rupture, and if that happens, then fecal material may end up going into the peritoneal cavity, this cavity right here, and it can cause a life-threatening type of infection called peritonitis. And so that's why if you have lower right quadrant pain, that they will do an ultrasound to see if that is your appendix. So gas is produced by foods that have indigestible or excess carbohydrates, and which are not absorbed when they get to the colon. And so the bacteria, our 400 different species, eat that indigestible stuff or excess carbohydrates, and they produce gas. I don't know if this is a dating fun fact, but we have 5 different gases that are produced: nitrogen, oxygen, carbon dioxide, hydrogen, and methane. And of course different gases have different smells. So for example, methane, and the overall smell that ends up escaping from our bodies is determined by the type of bacteria that's in your colon. Just by the way, babies are born with no bacteria, but are almost instantly, as soon as they enter the world, are inhabited. Bacteria move in right away. Again, I'm not sure if this is a dating fun fact, but I have been asked in the past, what determines what kind of noise that is made as gas escapes. The noise is actually not determined by the bacteria or what we eat. It's determined by the shape and the tightness of the muscle that is at the end of our anus, our anal sphincter. Vegetarians produce more gas than meat eaters because there's more indigestible stuff that's there. Most people produce between 200 to about 2,000 mils of gas per day, and we let go of that gas, whether you want to admit so or not, in about 13 to 14 different passages. One common disorder of the digestive tract, and particularly in the field of developmental services, is constipation. So as food moves through the large intestine, water is absorbed. If food residue stays in the large intestine too long, so if it's not moved along quickly enough, then too much water is reabsorbed and that material that is left, the stools, become very hard and they become difficult to then move through the rest of the intestine and to exit it. So what causes this slowness of moving food residue? Well, one of the main causes is a lack of fiber. So fiber holds on to water. So if there's fiber in our digestive tract, in their large colon, it's going to hold on to water, making stools softer, and it's going to stretch the intestine. And as it stretches it, the intestine will reflexly contract, and that speeds up how fast things move through it. Also, if we're dehydrated, then stools are going to be harder. Something I call failing to heed the call. So little kids, for example, they don't want to stop what they're doing, or sometimes people that feel uncomfortable in public bathrooms, and so even though they feel the need to release the waste products, they don't. And as a result, stuff stays in there longer and it becomes harder and constipation results. People that abuse laxatives, their intestine will lose muscle tone, and the intestine becomes dependent on the laxatives in order to be able to keep up its motility. Side effect of a number of different medications can cause constipation, so things like opioids, for example, or anything else that decreases the motility in the large intestine. So the nerves that are helping it contract, aging, even things like emotional stress or lack of exercise will slow down motility. So constipation can be annoying, or it can be a real health problem. It can lead to little pouches forming inside the large intestine, a condition called diverticulitis. It can cause hernias, hemorrhoids, tears in the large intestine, and untreated constipation can be life-threatening. So the best treatment of constipation is really prevention. And the best way is usually natural methods. So increasing fiber in the diet, making sure that they're taking in lots of fluids, having good bowel habits, exercise, and then there are medications you can take to relieve constipation. And we're going to talk about those. There's a variety of different medications. We'll talk about those in pharmacology. The opposite of constipation is diarrhea. And this is where the lining of the large intestine becomes irritated, and the intestine then increases its activity, increases its motility, and so that product, the stool, is rushed through and doesn't leave enough time for water to be absorbed, and so there's a lot of water that ends up in the stool. The biggest risk with diarrhea is loss of fluid, and of course as well, if stuff is rushed through the large intestine, then we can't absorb sodium and potassium as well. So a person can lose a lot of fluid, sodium, potassium, a lot of electrolytes. That irritation, the thing that causes that increased motility, could be a whole variety of things, including bacteria and various viruses. We'll talk about some drugs to help with diarrhea in pharmacology as well. One of the things that constipation can lead to are hemorrhoids, and hemorrhoids are enlarged veins in the rectal area. Now they can be on the inside of the rectum, or sometimes pressure can cause to push the veins through the anus, and we can actually see them on the outside of the anus. Things that increase pressure in that rectal area will cause hemorrhoids. So that could be constipation and constant straining. It could be prolonged standing or sitting. So for example, truck drivers. It could be pregnancy or obesity or childbirth. All of those things can lead to hemorrhoids. Usually hemorrhoids are painful, they may burn, they may itch, and they may cause bleeding, and usually we see that as bright red blood that we see on toilet paper, for example. It hasn't gone all the way through the digestive tract, it's bleeding that's right at the very end of the digestive tract. Obviously, things to prevent hemorrhoids are to prevent constipation. So all of those things that we talked about in terms of preventing constipation. There are some topical medications that can relieve that pain or burning or itching feeling. Warm sitz baths, so with a little bit of salt dissolved in the bathtub. There are some surgical procedures if hemorrhoids become very bad. The last thing I just want to talk about are some of the disorders of the large intestine. Inflammatory bowel disease, or IBD. This is an umbrella term to describe several different disorders that involve chronic inflammation of the digestive tract, usually of the intestines. The two most common types of IBD are Crohn's disease, which is chronic inflammation anywhere in the digestive tract, but usually within the small intestine, and ulcerative colitis, which is chronic inflammation of the colon and rectum. The cause of IBD is really unknown. So previously we thought that diet and stress caused IBD, but now it's known that these factors, although they aggravate IBD, they're not the underlying cause. One possible cause is an immune system malfunction. Both Crohn's disease and ulcerative colitis usually involve severe diarrhea, abdominal pain, fatigue, and weight loss. And this is an endoscopic view inside the large intestine, and we can see this inflammation. There's a number of treatment possibilities. Some of them are medications to try to reduce inflammation or to suppress the immune system or to treat symptoms. So, for example, for constipation, diarrhea, pain. There are some specialized diets that help to reduce the irritation of the bowel. And ultimately, if the bowel becomes damaged, there's surgery that can remove sections of the bowel. Irritable bowel syndrome, or IBS, is not inflammatory bowel disease. It is a very common chronic disorder that affects the large intestine, and it causes periodic episodes of abdominal cramping and pain, bloating, gas, diarrhea, and constipation, or both. Like IBD, IBS the cause is not known. It may be abnormal muscle contractions, and this is what we see here. This is thought that these abnormal muscle contractions that occur. It could be a problem with the nervous system, inflammation, infection, and or changes in bacteria in the colon. Different episodes of IBS can be triggered by certain foods, stress, even hormonal changes. There are some risk factors for IBS, and we're seeing this diagnosed more and more. Risk factors include age. So most people diagnosed with IBS are under the age of 50. Females are diagnosed with IBS more often than males. Genetics plays a role. So, for example, if there's a family history of irritable bowel syndrome, then there's an increased risk. And mental illness is also a risk factor as well. So people that have anxiety or depression have an increased risk of developing irritable bowel syndrome. The treatments usually involve figuring out and avoiding the triggers. So having high fiber and fluid in their diet, exercise, sleep. Some foods that may cause irritation and trigger an episode are things like foods that produce a lot of gas, so a lot of indigestible foods, gluten sometimes, certain types of carbohydrates. Medications that help reduce anxiety and depression usually reduce the episodes of irritable bowel syndrome. There are also some medications that can be taken to help with bowel function, so for example, constipation or diarrhea. And, of course, medications for pain as well. This is the end of the presentation on the digestive system. Please make sure that you view this presentation before pharmacology next Friday, and so that you have this background information. Thanks very much. Have a great day.